Well, we will be by the time.
Yeah, I will likely.
Oh, yeah. Good.
Even though this is probably good for no existing variant.
My husband, I mean, he was pretty sick for a few days, but no, he just started getting better, the voice started coming up. Yeah. So I guess.
Or afternoon, evening.
Due to the vaccination.
We're still afternoon.
He was sick, but he wasn't like. Yes, and I've never had it.
Oh, wow.
And,
Is our recording working?
The select few that hasn't done it.
Hey, Marlon.
Hey, look at us.
You got fancy names now.
You want to make Commissioner Andrade? We'll give her a couple minutes, and then we can start.
Probably
But yeah,
It's like all the
It's
players.
4
pardon me?
Probably lowest. So,
Excellent.
I saw him, he just.
Yes.
he was just
She's
walking
gonna
down
let
the
you know that we're getting ready to start, but if you'd like to do that.
Go ahead and start. Give me one moment.
Okay.
We don't have a lot to discuss, huh?
We have a topic, and we have a topic, and there's,
A topic or eight?
we have a topic.
Senior.
And it's just, that, small issue of homelessness and mental health, so,
But, I mean, I didn't come prepared with, we were supposed to be prepared with something. I mean, I could talk about it, of course, I could talk about anything.
Chair Morton, we're ready to start when you give us the go-ahead.
Excellent. Let's go ahead and do a call to order. Call this special meeting of the Public Health and Safety Commission to order. Let's go ahead and move to a roll call.
Commissioner Andrade is not here, but we will note the time if she does show up. Vice Chair Dominguez,
Present.
Chair Morton,
Present.
Commissioner Sales, Commissioner Taylor,
Here.
Commissioner Vaughn,
Here.
and Commissioner Woodstrake. Let the record show that all members of the commission are present with the exception of Commissioner Andrade.
Thank you very much. Let's move to the Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Excellent. I'm not aware of any changes to the agenda.
There is one change to the posted agenda. Item 5 has been removed by staff, and it will be coming back in September.
Excellent. I understand that 2 of the Solutions team member called in sick today. Hope they feel better. Look forward to hearing what they have to say to us in September. I don't see anything on our agenda space for public comment, but I'm aware that there's people here that would like to give public comment.
Since it is a special meeting, Chair Morton, they're only able to speak on agendized items.
Excellent. So we're here on action item number 1, the 6A, the one agenda item. So perhaps now's the time that we would like to hear from the public.
We do have one speaker for public comment, Peggy Walker.
Excellent.
Hello, I'm Peggy Walker. I work with San Diego Alliance for Drug-Free Youth, and for 30 years, we have worked to inform parents, youth, and cities in the San Diego region regarding the harms and risks of science-based fact, harms and risks of youth, alcohol, tobacco, marijuana, and other drug use, and its impact on mental health. And so I came today on behalf of San Diego Alliance to thank you for intertwining mental health into the purview of your commission. Mental health and substance abuse and homelessness. It's so important, and we hope that you'll especially consider youth mental health and substance abuse, the relationship, through our youth programs, and San Diego Alliance has many. We recognize that the mental health of young people has been hijacked by early use of alcohol, nicotine, and marijuana. And some quick facts I'd like to share. 90% of drug use begins before age 20, and almost 2/3 of those with mental disorders have onset before age 25. One of our serious concerns is that for young people whose brains don't fully develop before 25 or even age 27, marijuana can rewire the brain, causing addiction, psychosis, and other mental health issues, sometimes resulting in suicide, which we've seen in our San Diego Union High School district. Data shows our county is the second highest in the state for teen suicides. And the county coroner data shows that 39% of teen suicides show the existence of marijuana leading up to that. So I wanted to share with you some of our San Diego Alliance youth programs. I have a handout here highlighting our Study Buddy program. I can personally testify to the significance of an older teen mentor and an adult mentor, of a listening ear and the kind of impact it makes on a younger child's decision-making. So I wanted to share that data with you. I also wanted to share that one of our youth groups, the Changers teen group, just was recognized this morning by San Diego County Tobacco Coalition for their work in assessing tobacco and marijuana use at the fair. Both are banned. We found that use keeps creeping up. And after their assessment was made, they made a presentation to the Fair Board and were recommended or commended by Fair Board Commissioner for their work. So thank you very much.
Thank you very much.
That does conclude public speakers.
Excellent. So I think we're here to discuss and have a discussion between the homeless and the mental health, wellness, substance abuse, and addiction ad hoc committees. I'd like to entertain first, like, some ideas from the group on what we might want to accomplish in the next hour, and then kind of open it up for kind of discussion from there. So I'll just frame that our goal and power is to make recommendations to the city council. So that's what we're trying to do, is come up with our ideas for that. And that's what I would just sort of say is a guiding sort of outcome for today, is as we move towards the recommendations we have to make at the end of the year, that's what we're moving towards. But anybody else particularly have a goal that they'd like to work towards over the next hour we can talk about?
I pressed the request to speak, but I don't know if it works that way.
So you did, Commissioner Woods-Drake.
Did I do it at the right agenda
did.
item?
You
Okay.
did.
I just want to second what you're saying. I think working together of how to overlap the two ad hoc committees to come up with some goals or some recommendations that we could present would be great. I know that myself and Robin talked a little bit last session about some goals that we had and potential recommendations and things we're working on within the mental health and ad hoc specifically. So I think it would be beneficial to hear from the homeless group about what some of their goals are that might overlap into the mental health, and then that way we can kind of all work together. Because I think we're focusing largely on mental health and wellness within our youth community, but do want to also support what's happening within our unhoused community. And so it might be beneficial to hear from Marlon and Dan what some of the work that they're focusing on, and then we can share how that could overlap.
Excellent. So what I'm hearing is a core foundation of the work that you've been doing with the mental health has been the youth. It'd be nice to just sort of get our take from the homeless ad hoc committee, which is Dan and I, and that's fine. And where there might be some overlapping and some insight into the homelessness that you might not be aware of. I have an idea, Dan, but do you have anything to say? Okay. So I'm going to frame our recommendations that we're seeing and that I've been able to glean from Dan seem to be around the Built for Zero model. So Dan, I'm going to give you the floor since you're the most educated about that model, and maybe you can help answer Commissioner Woods-Drake's question about, where the mental health piece of that program is and how that overlaps with homelessness.
Yeah, so I guess a lot of my insights are guided primarily by the work that I do with St. Andrews and the homeless population directly. And so to just give a sense of the scope of that work, we host folks experiencing homelessness every Saturday morning from 8 to noon. We provide showers, a hot meal, clothing. A wonderful woman, Lee, gives haircuts to anybody who wants them. We have the county come out once a month, the Office of Homeless Solutions. They do benefit enrollment and case management. And so far through the end of July, we had hosted 249 separate individuals. And over those 30 weeks, 4 individuals had showed up every single week, and a majority of people had only showed up once or twice. The folks that we see most regularly, let's say more than half the time, we try to do case conferencing on them. And case conferencing is a process in the homeless response space where we get together to talk about individuals on a by-name basis and share our insights from interactions with them and strategize about what would be an appropriate next step to try to work forward with. The Buena Creek Nav Center came online in roughly March of this year, and working with the street outreach worker from the county, Chad Ryan, we put in 8 of the 12 initial placements and have seen folks go through the Buena Creek system. Some have gone on to be housed, some have come back to us unsuccessful at Buena Creek. And so we have some insights into those dynamics, and it's a learning curve. It's definitely a useful tool to have in the arsenal, but it's it's a new program and it has a number of challenges. One of the things that I think would be great for our commission is if we could get the city staff to provide summary numbers of who went in, what were the successes, what were the challenges, what are their perceptions of how that's working, what do they need to make that more successful. One of the challenges I know we have is mental health and physical health issues. Some of the folks that are our clients, our guests, that have gone on to Buena Creek have been hospitalized with emergency situations. Many of them have suffered from significant mental health crises. And it would be great if we could systematically sort of screen and connect folks experiencing homelessness to the medical and mental health, behavioral health resources. One of the programs that the state has put forward is called CalAIM, and it provides funding for folks experiencing homelessness to address housing needs as part of their medical expenses. It's a relatively new program. We talked with city staff about it when we met with them last month, and they're aware of the program. But it's not yet something that they have up and running. We partner with the city of Vista on the Buena Creek Center, and Daniel, the lead city staffer for Vista, is working to try to put in place something the staff updated with there. And so that could be a great opportunity for those Buena Creek citizens. And what would be nice is if over time we can incorporate that into street outreach and the other outreach activities that are happening in the city, such as the St. Andrews program. There's a Fill-A-Belly meal, hot meal on Thursday afternoons that the Methodist Church puts on. There's a sort of laundry love program where folks can show up at the laundromat and have the laundry paid for them to wash their laundry certain times. And so there are these outreach programs, as well as the CRC support work, et cetera. So to the extent that we can try to connect folks to the medical and mental health resources that are out there and take advantage of some of the funding that the state is putting forward for the homelessness as a population of focus, I see that as a huge opportunity.
And so before I open up questions for Commissioner Vaughn, I'm just going to add, from what I've learned from the Built for Zero model that Dan's like advocating for, it's key to identify the homeless as individuals and to begin to develop case management for the people individually, right? And that's where the mental health comes in, right? Because not everybody that's homeless has mental health, but some do, right? And so it becomes trying to find that way and the resources that you can intervene. And I was particularly touched by city staff when they talked about something that works for mental health as well, which is they're in an environment where they are hit with what it feels like a million no's. Much like people that are trying to get sober and do mental recovery and try to get help. And like they have to keep working until there's that right moment and the no is a yes. And we just never know when that is. But being able to have the personal relationships, which is the foundation for the Built for Zero, is key to what we're trying to do. So any recommendation that we have is going to, I think, build upon that. Any questions for Commissioner Vaughn? I'll start with Commissioner Woods-Drake.
That was from before, but I do have a question. Thanks so much, Dan. I was not familiar with CalAIM, and so I don't know how much of an expert you are on that, but is it that people who meet certain medical qualifications, whether it be mental health or physical health, would be the ones that would qualify for funding for housing through CalAIM? Or is it a general fund that cities can apply for and then they can dispense it the way that they see?
Yeah, so it's medical reimbursement. So the service providers bill the Medi-Cal insurance provider. And the program that's particularly relevant here is something called enhanced case management. And so that's having something of a caseworker working with the individual who's experiencing homelessness and has complex medical needs. These can be mental health needs, physical health needs, and in many cases, it's more than one of those. And so what we see is that most clients have multiple different places that they need to touch base with. And as you can imagine, when you're housed and have transportation and stuff, that can be a royal pain. But if you don't have a car, if you're living on the street, it's almost impossible. And so one of the things that this tries to do is to help the individual coordinate their care among the various caregivers, be a single point that sort of connects and supports them. But it also has access to some of these additional funding sources, like housing support. So I can talk from the perspective of a parent, which is where I know it the best. So my son, who has schizophrenia, also has type 1 diabetes, has been homeless, and he is on this CalAIM program. He has enhanced case management, and one of the things he has a hard time with is a lot of sleepiness. He sleeps a lot of the time, sleeps late. It's frustrating to him. And the questions are, is this a side effect of the medications, which it possibly is, but there's another possibility, which is that his type 1 diabetes isn't very well controlled, and so that can also cause some of the sleepiness. And so one of the programs that we're trying to take advantage of there is to get him on an insulin pump to better control his diabetes, and hopefully that can help provide some symptom relief from the sleepiness. So that's an example. It's very much a work in progress. The reason we got him connected to that is because I'm an advocate in this space and I knew about it, and I pushed the county mental health system to make that referral, and they did.
Commissioner Sales?
There I am. Okay, so CalAIM is a reform of Medi-Cal, basically, state reform. It has its hands in medical and behavioral health, okay? So one of the things that CalAIM is allowing counties to do is to pay for services that they never paid for before that were not reimbursable. For example, peer support specialists. And the reason I'm bringing this up is because that is something that would really help a lot of these people, is to have a partner, somebody who can help guide them, who understands because they are peers and they've gone through their own behavioral health crises. So that's a really important point. Does the program, your program that you've just talked about, get any county funding?
I don't believe so. It's Vista Community Clinic that he's working through.
It's through the church, right? So,
No. This is, so he's an MHS client up in Oceanside. And,
MHS.
And the the housing specialist up there referred him to Vista Community Clinic for the enhanced case management, and his psychiatrist to the strength-based counseling. So both of those have access to some of this population of focus resources. But I think that it's the strength-based counseling that would be the county funds. I think the Vista Community Clinic just taps into Medi-Cal directly.
okay. So the other thing I was going to say is with the Prop 1 funding, the county requested funds for recuperative care beds, and that is going to be something that people who have severe medical issues, they come out of the hospital, they have nowhere to go, okay? That is a challenge. There's one place in the whole county right now, basically, which is in Escondido, and it's run by Interfaith Community Services, and they have never been at full capacity, because the problem is people can recuperate there, but they have no medical services. They can't provide nursing care. They don't have physicians, but it is a place for homeless folks who get discharged from the hospital to go to recuperate, so they're not recuperating. For example, if they had a serious wound, they would have a place to go and be able to rest safely and be clean. But unfortunately, those programs don't provide the medical services that a lot of these folks need for follow-up. And I know, like Interfaith Community Services, almost all of these agencies have county contracts. They all do, either from Health and Human Services or Behavioral Health Services specifically. So the county did apply through Prop 1 to get those recuperative care beds. And I believe that's either been approved or it's coming down. I think it was $14 million that the county, so the Prop 1, the county's applied for 3 different areas because Prop 1 says that the number one concern is prevention of homelessness because of people's behavioral health issues. So good things are coming down, but you know how long it takes. And we all know about getting any kind of housing built takes a very long time. So I hope that was helpful. The other thing is that it is important that any of the programs, it is important that any of the programs anywhere get support from the county behavioral health, from the contract agencies. So if there's a problem with that, we need to figure out a way to help folks that way, is get the services they need.
Commissioner Taylor.
So part of my frustration with the approaches that our city and many surrounding cities have taken with regards to homelessness is the fact that we continue to avoid addressing the root problems to this. We treat this as if people are out on the streets because that's what they want to do. We are not addressing the fact that, and I don't know what the city of Encinitas is capable of doing, because some of these issues are bigger than the city of Encinitas or the city of Carlsbad or Oceanside or Solana Beach. And some of those root causes are a lack of affordable housing, lacks of meaningful wages. You have a number of people that have mental health issues that are self-medicating because they cannot afford to pay for the medical care that they need to get the medical assistance that they need. And it's this combination of things that results in people ending up on the streets. And COVID exposed all of that to us all. So I feel like a lot of the solutions that we are looking at, the city is looking at, and again, our neighboring communities, it's just a matter of moving people around instead of actually helping people. So that's my biggest frustration. Yes, we can move these people around to this center, but then what? Are we helping them address their situations? Are we helping them, preventing them from self-medicating? Are we helping them, in a meaningful way to find housing? And yes, I get it that there are going to be a number of people that are resistant to help and support. But I also believe that there are a number of people that are looking for that help and support. But our problem is we lump all of these people under the same umbrella and assume that, one homeless person is like all of the others. And, these individuals are not a monolith. They have individual stories, individual issues. And, I just feel like we haven't done a good enough job as a collective to figure out solutions for this situation, because it's not going away anytime soon, unfortunately. So, I guess my question is are there any solutions that the city can pursue that would actually help not only get people off the streets, but keep them off the streets instead of just moving them around from one center to the next?
I think the staff presentation that we'll get in September is going to provide their best solutions for that. So I look forward to hearing what they have to say of what they are doing. Vice Chair Dominguez?
So speaking to root causes, right? We had Peggy do a presentation here about the youth. And my question is, what are we doing? I mean, this is sort of where it starts, right? The issues of drug abuse or mental illness start with youth. And so are we focusing enough? Can we make a recommendation to the city to look at ways to help youth so that they don't end up being in a position that they're over there at St. Andrews, and what is the city doing, and what can we do more? Can we make a recommendation that the city look at trying to do something preventative on the front end so that, we won't have to see them at St. Andrews or other places? And, I think that's something we should look at and focus on, because I really think that's it's important.
Would you mind rephrasing that, just because I had a lot of stuff going in my mind? Could you say that again? What do you want the city to focus on?
I want the city to, I want the commission to make a recommendation for the city to look at ways to support youth programs with the intent to deal with some of the root causes of homelessness, mental health, wellness, substance abuse, and addiction. And maybe try to do a little more in that area. It's a big problem, right? It's multifaceted. So, but I think we should invest in our youth because there are a lot of people that, quite frankly, they're to the point where they're not as open to help as others. And I think that that's a good starting point. Starting there would probably work well.
Excellent, thank you. Commissioner Woods-Drake?
So I had, prior to Chair Dominguez speaking, had put down preventive care and resources in general as a recommendation. So similar to St. Andrews, when Encinitas for Equality had our public space, we were doing monthly partnership with Humanity Showers, and a number of the guests that we had come through for showers, haircuts, similar breakfast, shared that they became unhoused because they lost their jobs during COVID and unemployment wasn't enough to pay their rent. And so I think it's so multifaceted, where there's the mental health, there's, the addiction component, but then there's also just people living paycheck to paycheck, and one bad month ends up in a situation where they're unhoused. And what I know in Encinitas, if you're living in a place where you're currently paying $2,000 a month because you got in 8 years ago, that same place is going to be $4,000 if you end up getting evicted. And so I think making recommendations to the city or finding out what exists currently. I know during COVID that the county, and I think some cities had some rental support that was being offered, but I wonder if through CalAIM, there's possibility to use that enhanced case management to identify people who might be struggling with mental health issues that, are potentially not able to go to work right now because they're going through postpartum depression or anxiety, or, it's like newly into an addiction. And if we're able to have a program that they could be supported for a couple months to maintain their home, that's the first step for people then to be able to have that continuance of care where they have their home and then they're not losing their car and their next thing. So I think looking into preventive care, I agree with you entirely, Alex. Like, there's multiple ways to prevent people from becoming unhoused, because it's so much harder when someone is unhoused to fix that. So totally agree with that. And then I just want to reframe and bring up the some of the goals that Robin and I had mentioned that I think echo and go along with what you're talking about, Alex, for the youth. One of which is, and Robin knows far more about this than I do, but the screening to care in the schools that begins at 7th grade. And so that's a county program that our recommendation would be to San Diego Unified High School District. And I think really it's figuring out how do we make a recommendation to the city to work more closely to support and work with the high school. And fortunately, we have Marlon, who's on the EUSD board, to even figure out how are we working with families at the lower level to start these programs. Creating the resource van, which is something that currently exists in Escondido at their high schools, which allow, it's like healthy snacks and resources. And I think also looking at, there's the Safe Parking Lot program, and a number of the families that have gone in and out of there are unhoused youth that go to our school systems. So it's also figuring out how do we work with these families? Because if you're an unhoused youth, I feel like you are just predispositioned for more of these issues that are going to come up later, whether it's, addiction and looking for that, or depression and anxiety and, feeling left out and all those things. So I think also figuring out how are we, again, working with the school system. So I think it's really, and I'm hoping that we can have Brian Marcus come here and present and talk to us as well about what San Diego Unified High School District is currently doing and how we can, potentially use city resources, which perhaps come from CalAIM or something else. But, it's like there's a lot of needs and obviously not an unlimited amount of money, but figuring out, I'm with you, Alex, and prevention is super instrumental to making sure that we're not exasperating what is already an enormous flood, that we're trying to figure out how to sop that up with not a lot of resources. So I think, yes, working with the schools, partnering with the schools, but also for those adults that might be just on like that edge of maintaining their housing right now or losing it, how are we potentially case managing them and offering resources in a way that's going to keep them within their homes and our neighbors here in our community.
Thank you. Commissioner Sales?
Thank you. I agree. Everything Molly said, I was writing down here because I was going to say the same thing, so I'm not going to repeat any of that. I would think, and I know the city council gets reports, and I think I'll ask the sheriff's department about from the safe parking program. How often can somebody maybe can answer that? How often does Jewish Family Service come and talk about the program and how it's going? And is that something you can answer? Anybody?
They have not come to City Council for a while. I do think that they correspond with our homeless solutions coordinators and possibly provide them numbers, but they have not done a report to Council for a while. But we are certainly allowed to ask for information from that organization.
I really think that would be a good idea, is to invite them, because I think it's really important. The safe parking program, I understand, is pretty well subscribed. But I would like to know the statistics in terms of, and the stories, because I think the stories are important. It's how people get into housing, how long it takes. Because as Molly said, these are kids who, might be going to Oakcrest, get out of their car and go up to Oakcrest. And it's really difficult for young people to live that life, and the trauma and the feelings of unsafety of living in your car, and I think that's a huge thing. So I would like to see if we could invite someone from Jewish Family Service to come and talk about this particular program as opposed to the other safe parking lots. I don't know how folks feel about that. I think it would be helpful in sort of understanding, is there a trajectory for people in that kind of situation? And because our ideal goal would be get everybody out of the safe parking program into housing, not to keep them there.
Thank you.
So just an update on the safe parking program, folks. So more than half of them are part of our Saturday morning community, and so I know them reasonably well. And we've placed several folks into Buena Creek from the Safe Parking Lot program, including a successful three-generation family that we were updated on in our meeting with the city staff last month. So I do think that from city staff for their summary of statistics, both Buena Creek and the safe parking lot would be useful.
Commissioner Taylor.
To follow up on some of the things Alex mentioned, and those are all great points again, Alex, about addressing the youth and early on. I'd like to talk about some of the things that we're doing within EUSD to kind of address some of that. We were just given the green light, and this school year we're going to start expanding our free meals to go from breakfast to include lunch as well. Because we recognize that there are a number of families within the community that are living from paycheck to paycheck or less. And, because of pride and different things, it's really hard to get an honest gauge on who these families are. Because people don't want to go through the process of putting all their business out there, of filling out a form to say, hey, you need assistance. So that program doesn't require any paperwork, doesn't require any notification or anything. It's something that every child will get. Additionally, last year, we expanded our community liaisons. I believe we have 3 within the district now. And these individuals, they work with families across the district to help translate any of the documents that we have, to help find any resources that these families may need. And I think those are good resources to have as well, because I believe that these individuals may know more about some of our struggling families because of the interactions that they have with them than, I think any of the administrators may have. So I think that's something that I can ask some people about. And then ultimately, especially in our district, I'm speaking from the K through 6 perspective, I think another good avenue or resource that we can touch into is our PTAs across the district. Because, again, being able to have families connect with other families and, through our PTAs, if they are effective, we should be able to, and we've done this before, we did food drives during COVID, and there have been toy drives that have happened over the years. So our PTAs, I'm fairly confident in the fact that they know the families within our schools that may be struggling or may be having some of these issues. So being able to get out in front of them to talk to the PTAs and, disperse some of this information to them may be a very good start. And, again, I can connect with the district to figure out when the PTA presidents' meetings are so that the presidents of these groups can, hear some of the solutions or some of the things that are available, and then they can cascade it down to their individual schools. So.
Thank you. I'll just take a few moments if you don't mind. Dan, a key point of your presentation of what you mentioned was a request from the city to summarize the numbers to us, to we, like in your vision and like in your recommendation, who's the we? Who are they summarizing? Or do you see them summarizing to, who's the we?
To the public through this commission.
Through this commission, so like you would see recommending that propose probably, if there was a way that they could make it probably public through the city council as well, or just on them, that might be another way that it could go. But that just seemed to be a key point so we could identify for them in our recommendation. Would you mind expanding on the benefit of that for us?
Yeah, right. I mean, I think you've done enough project management to know if we can measure it, we can manage it. Mm-hmm. And one of the key things that we want to make sure we're doing is understanding how these resources, whether it's the safe parking lot or the Buena Creek Nav Center, how many people are they serving? How long are they serving? What's the outcome for these folks? Did they move into permanent housing? Did they move into temporary housing? Did they move back to the streets? And those outcomes, I think, is part of that measuring, right? And it's sort of tied back into that Built for Zero thing that we were talking about, right? Where you've got the by name list. This wouldn't be a by name list. This would be a summary of aggregate depersonalized totals, but how do we improve things? Well, we first need to know what the baseline is.
Excellent. So I'm seeing some sort of addition to the annual report that they probably give to City Council, where there's just, and the word I think we've all talked about that everybody likes to hear is just transparency, right? Everybody is looking for transparency, just wants some communication for what's going on. And I also want to highlight that I think recommendations that we're talking about, and from the little bit I've done, so much of the resourcing is coming from county, right? And so anything we can do to highlight ways that we can secure that Encinitas is tapped into the county for the resources is going to be a recommendation, I think, that we all would support. And then I continue to be struck by the number, because I'm an outsider to a lot of this and just coming to it, but the parking lot program, the Jewish families, that. So, and I'm at a loss, I haven't done the investigation, but if anybody could speak to, like, are all of these resources that are, I guess would be framed as non-governmental, are they like listed anywhere? Or is it easily found someplace?
So within the homeless response space, it's not actually the county, it's that regional task force on homelessness, RTFH, that is the clearing agency for federal money mostly. And so the county is responsible for behavioral health, social services support for folks, but the city is primarily responsible for housing issues. And RTFH is the agency for small cities like Encinitas to access the federal money. We have a housing agency, so the Section 8 vouchers is different, but the money that goes to the region, Carlsbad has a program for rapid rehousing where they get financing directly from RTFH to help with that economic bridge between what it costs to rent in these coastal communities and what people on fixed incomes could reasonably afford.
Okay. So I think anything we can do to help identify ways to make sure Encinitas isn't missing out on money, is like work we can do. So, and I think the next step to Commissioner Dominguez's sort of point, like we should have a recommendation to support youth programs to get to the deal with the root cause, like it's going to be way more productive if we can identify the types of programs for them, right? Like going to them and say, we should support these short programs, like we're being asked, if we can with all of our knowledge, to like do outside work and bring to the table in the recommendations, like these are programs like these. And then my final comment I make, just because I feel compelled because the homeless staff's not here, my takeaway from them in our meeting with is there are a number of things that they can absolutely be proud about in what they're doing with homelessness, right? Absolutely working their butt off. And some of the things that they're talking on, they've added a particular staff member since we last talked. They're making a number of initiatives. But what we can best serve as this outside light for them, right, is to say, with your limited resources, either yes, I think you're absolutely doing what you're doing is absolutely fantastic and absolutely right, or it's you're doing great, but maybe some of these programs would be better spent, right? Because all of them are just, it's just, like we said, like we're managing resources. And the complex problems like these are not puzzles, right? Puzzles are wonderful because puzzles have a solution. We can all get behind it, right? This is really just a real mystery, right? And so it's like trying to like navigate the feelings and the frustration of this messy middle of this amazing mystery that we're doing. And really all we can do, the best we can do is just like our best indicated steps, and just one step at a time. So really like the way this discussion's going. I think we can keep going But I would like to know if anybody's been taking notes, like I have, for specific recommendations that they're kind of walking away from. So I think, I'm not quite sure where we are on the order of this. I have Commissioner Dominguez coming up first. So do you have particular recommendations that you think that you could come
Well, I
up
made
with?
the recommendation, I think you wrote that a number of times. They're invested in the community. You know, that might be a starting point. I don't know how the city council might view one program over another, but I think the focus should be locally and not some outside group that comes in and provides some, I don't know, some service. But this conversation has moved very quickly from one topic to another. So I just want to go back and ask the captain, Captain Watts, if, you know, there was some significant concern about this safe parking lot program. And when it was started, that there would be issues or problems there. And I'm just wondering, from your perspective, has there been any significant issues? Obviously, you're going to get calls with large groups of people in one place. But from your perspective, do you see that parking lot program as being any issue in regards to public safety?
Thank you for the question. We have not seen any significant issues stemming from that parking lot. The people that are utilizing that parking lot are very thankful for it. These are the people that are ready and non-resistant to resources, and they're kind of in that in-between. But if anything, it's been a great opportunity for us to engage with that segment of the population, but no issues that have arisen because that population is parking there.
Thank you. Commissioner Sales?
Yeah, it's really, I would really appreciate the presentation from the Homeless Solutions team, because I think there's so much that has been done and is being planned, and I think we're jumping the gun without knowing what they're doing. I mean, we can make a recommendation. It may be redundant because they may have already done that. So I mean, I'm sorry they weren't able to be here today, but I don't really think we should be discussing this without them, without knowing fully,
Yeah,
including the sheriff's department involvement with that team. So,
yeah, and we're not, like, recommendations that we're going to actually give to the city commission as part of our report at the end of December. So just thinking like what our draft considerations for recommendations would be is kind of what I'm thinking, because we can't do anything. I mean, we just, like, we're going to do a report, so what you're thinking, but your point's well taken. Like, we certainly need to have the feedback to know what's actually working. I have a sense of it, but.
yeah, I would not like us to be doing something that's already done or making recommendations that have already gone to city council we may not know about. So I'm saying we put the brakes on making recommendations until we get that presentation, then we see what the gaps are.
I'm just suggesting these are draft discussions and trying to get it everything on the table. Like, I don't think we can really vote on recommendations that we're going to have in the report right now. That's all I'm kind of looking for. So I concur with what you're saying, right? It would be premature to sort of finalize what that's going to look like. I'm going to take the liberty of just go down the line instead of following the loop here. So, Commissioner Taylor, you want to go ahead?
Yeah, so some of the things that I had as a follow-on note, one was to connect with the PTA president. Another that, you know, was born from this recent conversation is maybe we can reach out to the homeless group that the city has to figure out all of the programs that are out there. You know, what's the desired goal of each of these programs? Who's the target audience for these programs? And then that way we can then easily identify what the gaps are. And, you know, and I think the solutions are, actually, there are no solutions because, you know, we're still, you know, these programs are probably still not dealing with the root causes of these things. But, if we look at all these programs that are out there, see who the target audience is, what's the desired outcome, we can then identify the gaps and try to figure it out as best as possible from there.
You're like hitting a sweet spot for me. I'm like imagining like an Excel spreadsheet and things off, things up, and
That's
check the
what I'm
boxes
talking
and
about.
gaps and holes.
That's exactly what I'm talking
and
about.
somebody else preparing it.
I've already got it for you. We'll send it to Lois.
Dan,
I think I'd just like to invite the captain to present his initial impressions. I know you're relatively new to the role. I've worked with Deputy Wells for years on these issues, and I understand you've got some new reinforcements in the cops division. Maybe you can just update us on your initial take.
Yes, thank you for the question. We did add, the city added 2 more positions to the homeless outreach team. So that gave us a more robust unit and gave us the luxury of now having weekend coverage, where I think that was a gap that we were missing. But we have closed that, and then working with Stephen and Sam for that weekend coverage, it's working. Everything that we're doing is on a foundation of trust. And that's what that unit is doing with the community, is they're building that trust, and that takes so much time. And it's not the first time we meet with them, and maybe it can be the first time, but a lot of times it's the 3rd, the 4th, the 5th, the 6th time of us just reaching out and making those resources available. And we hope that they take advantage of that. But the work that I have seen the team do on a daily basis, it is impressive. I know I've heard somebody say that it's frustrating, but we have to take action, and we have to be there for them. And that is what our deputies are doing, is we're putting our enforcement hat away, and we are just being an ear and somebody that can offer them resources. And we've made a lot of progress. We're on first name basis with a lot of that segment within the community, and we are building that trust. There's always going to be those that are resistant, but over time and with continued contact, we hope that we can get them to a place, whether it is mental illness that we're dealing with or substance abuse and addiction issues. Those are major issues in themselves. And then you combine that with being unhoused. Somebody already said it. It is a vicious cycle. But we have to get to the root of it, and that starts with action. And that's what we are doing. We're applying everything that we have in our ability to reach them and provide them a place where they can get the help. They can get off the streets. They can get rid of their addictions and get help with the mental illness. But the program has come a long ways, and it's impressive to see.
all right. Finally, just coming down the line here.
Yeah, I can provide a list of resources that is pretty robust to Lois, and then you can send it out to everyone, and then we can work through that. But that already exists, so I can provide that. And then I have been taking notes as well of just kind of recommendations that people have been dropping in here. I think one that is not contingent on hearing from the homeless outreach team, and I think just want to lift up while we have Peggy here from the San Diego Alliance is, one of the recommendations I think that Robin and I will put forth will be to have the annual mental health and wellness event put on by the city in May, which is Mental Health Month. And I think to Chair Dominguez's point about preventive care, finding out how we can partner with the San Diego Alliance and those NAMI and those that are already working with the youth to create a really robust event that would be great for adults, but as well as our youth will be really valuable experience. And so that's one that I just want to highlight that I think will capture some of those goals.
Excellent. So we're here, just want to take a pulse of the conversation, I think, really. And is anybody particularly passionate about a direction that we feel like we should go on what they're talking about? Is that too much of a softball and too vague for everybody to answer? Okay. Commissioner Chair, you're up next.
Oh, I was just going to ask Captain Watts a tough question. Okay, so here's the question. How does your team balance enforcement versus helping people? I think that would be really good for Dan to hear. Because I think it's an issue, right? Because, we wear badges, we have guns, and it must be a tough balance for you. So I'm just wondering if you could speak to that. Or if that's too tough of a question, you can tell me to shut up.
No, that's a fair question. But it's not a clear line. I think, each patient presents its own set of circumstances, and we deal with the patient. And if they are service resistant and they're also either creating a disturbance to the public or creating an unsafe space for the public, then that's when we would have to transition to enforcement for the safety of the public. But that doesn't mean that might be today's interaction. But tomorrow's interaction, we're going to come back with a place of providing resources. So I guess it depends on what the patient is presenting to us at that time and the circumstances revolving around our interaction.
Perfect.
If that answers the question.
Commissioner Sales?
Yeah, that's a great segue into what I was going to ask about was SB 43, because now we're only 5 months out, and I know that there's been significant training offered through Jewish Family Service Patient Advocacy Program to law enforcement, and I'm hoping you've all participated, or at least your part in the Sheriff's Department is training folks, because that's going to be an issue is when, and you probably already take people to the hospital who have severe substance use issues. I'm sure that happens. How do you anticipate that SB 43 is going to change the way you help people or detain people? Do you have a sense of that?
Well, I think like most of these bills that come down, I think we kind of just work our way through it. But I think as long as we're putting the patient's needs as a priority, then we're doing the right thing. And I think that is the focus of law enforcement, is making sure that we're putting the individual's needs first and foremost.
Sorry. Just a comment. One thing that we discussed at the Behavioral Health Advisory Board last week or the week before, whatever it was we were talking about SB 43, and oftentimes people are brought to the emergency rooms, and currently there's really no place for people to go after the emergency room. But one of the changes that's coming down is the crisis stabilization unit in Oceanside, Vista, all over the county. They are designated as LPS facilities, so they can deal with people and put them on a 72-hour hold. So this was where CalAIM comes in, is that trying to figure out the funding so that the crisis stabilization units can get paid for doing the work that they're doing for people who have uniquely substance use disorder, severe substance use disorder. So it'll be interesting to see how that plays out. Part of it is the training of everybody in the whole system. It's not just focused on law enforcement. It's every level. But it's also about resources and where people are going to go after they leave the CSU. And this is what County Behavioral Health Services and the Board of Supervisors are working on. And I think that applies to Encinitas. We have to understand this is a county-wide, well, it's a nationwide issue, right? It's not just our county. But it can't be solved uniquely by Encinitas, but the homeless team receives money from the county, and I think that's important that we help as a commission, to see what we can do to support those efforts to get more beds, to get more services, and especially beds for people who are experiencing that.
Commissioner Taylor?
Captain, the PERT, do you happen to have any idea of how widely used in Encinitas is the PERT?
So we currently have one clinician that rides with one of our deputies, and they do respond to any calls for service that would require a clinician to be there to assess the person. I think we see a lot of it during the school year, and we're going to a lot of schools to talk to the kids who may be experiencing some sort of horrific event or going through some kind of crisis. So I would say during the school year, we are utilized quite a bit at our schools. We have a second clinician coming on board here soon.
Oh, good.
So we'll have 2 out in the field, but they are used and utilized on a daily basis.
Okay, good. Jennifer or Lois, do we have any metrics about the Mobile Crisis Response Team, MCRT, usage in Encinitas?
That is done through the county, so we can request that. One of the things that I just wanted to let the commission know is that on the website, we do have a homeless resource page, and it has everything from our homeless action plan. It goes back and it has all the updates that went to council. It's got the homeless outreach or the HOPE team information. It's got JFS. It has open doors program, emergency shelters, seasonal and other shelter programs. It talks about the mobile crisis unit, the 988 Suicide and Crisis Lifeline, as well as additional resources, which talks about, as Commissioner Vaughn knows, several churches in the area, interfaith. So we do have those resources, as Commissioner Woods-Drake had mentioned. We do have those, but that would be numbers that we can request from the county as well. And one of the other things I do want to let you folks know is that we will be having a homeless action plan update in probably the next month or so that will go to council as well.
Awesome. And my last question is there anything that we can do better as a city at promoting some of those services via social media or using some of the local media outlets like the Encinitas Advocate or Coast News, just to kind of remind people that some of these things are out there and exist?
I'm just going to kind of step in. So those are difficult questions for them to answer, right? So they're doing what they're doing. So it's appropriate to kind of ask, what are they doing? But then it's on us to say what they might be doing better, right? You see what I'm kind of getting at?
Not really.
I think you're, if I hear you correctly, they can tell us what they're doing and then we can make a recommendation.
That's correct.
Such as social media might not be the best place for resources, but a bus stop putting a laminated
I think
flyer.
we can go forward that they are doing the best they can with the tool they have, and they actually are doing a great job. But it's on us to sort of assess what they are doing, and if we think and can make a recommendation for something that's better.
Oh yeah, no,
Right.
no doubt about that. No, I was just asking, are there things that we can do more of? Because I'm talking from the perspective of being an Encinitas resident and some of the things that I see versus what I don't see. Mm-hmm. So,
yeah, I don't want to beat a dead horse, but my understanding and the respective is that the city staff is following the recommendations of the city council to the best of their ability, right? And they're going to follow the leadership that they get from city council, and so that's almost a question for city council, are we directing them in the right way?
Chair, if I might ask,
Yeah.
can we just make a request of the city to provide us with how are you distributing these resources? We can review that, and then we can make a recommendation of some other.
That's exactly
Okay,
what I think
thank you.
where we should be. So, are you open to that recommendation, city staff? Thank you. Did you have other things to talk about, Commissioner Taylor? Okay. I would round back to Commissioner Wood-Drake's original question to us as part of the homeless ad hoc, like what we're doing with mental health, and just sort of summarize. And it was echoed by the captain, and it's what I said before in this Built for Zero model that we'll be recommending following is individual participation and understanding of where each individual person are, recognizing that not every person is homeless there because of mental health, but that each person, there are plenty of people that have their own concerns. And so like the importance of trying to stress and communicate many of the ways that the city is doing that in a transparent fashion, so maybe we can find a better way to do it. I'm kind of struck by like that's the only answer I have for you, right? I mean, Dan, is there anything else that like mental health like in our homeless and the mental health and the interaction that we could say?
Well, right. I mean, I think the reality is that at the root, homelessness is a housing issue. The cost of housing is too expensive for too many people. However, the population that ends up homeless is disproportionately predisposed to mental illness, including substance abuse, and the traumas of living on the street compound and complicate and push people who might otherwise manage to places where they're not managing, right? And so the people who are homeless are very much like all the rest of us. It's just harder and more public.
Mm-hmm. Yeah. Anything from the mental health ad hoc sort of on that? I mean, the homeless committee didn't come up specifically with any questions for you like you did for us, but.
Well, I think what Molly said is, we made some recommendations at our last meeting about who we'd like to hear from. So I would like to invite Brian Marcus. Can we officially do that? From the San Diego High School District? One of the things that for example, the Screening to Care program which is only a middle school program. It's not a high school program. But the district has not adopted it yet. I don't know what the barriers are. When I met with him, I got the feeling, and this is just a feeling, that, it's really a hard thing to get parents to agree to. But there are school districts that are doing it, and including Escondido, where our superintendent came from Escondido Union High School or elementary school district, I'm not sure which. Well, they have a unified school district. So she has a sense of what happened and how it's working. And I'm not sure, but Encinitas is a really tough place to institute new policies, as Marlon can attest. There's a lot of parental concern about privacy, et cetera, et cetera. But
I don't think there's a problem with us requesting people to come. We can actually
how do we
ask
do
city
that and
staff
get that
to do that
set
for
up?
us.
Yeah.
We need to have a consensus amongst us that that's what we'd like to do. So would you like to make a nomination?
Okay.
Yeah.
Do you need us to make a formal motion, or?
I don't know, do we or do we not?
You don't need to make a formal motion.
Excellent, I
just
love that.
consensus.
Yeah, so we'd like to do that. We also mentioned Jewish Family League services. We mentioned PTA presidents. Like to have us come. Are we all?
I would recommend that if we're going to have someone for San Diego come by, it would be a complete picture to have someone from Encinitas Union and
Excellent.
Cardiff school districts
Great
be
idea.
there as well. That way you get the entire scope of people that are dealing with kids in our community.
And, and the rationale, the thought behind to help us understand the landscape that we're in and pertinent issues that they're dealing with to face
Right.
up the mental health and homelessness situation for our youth. And also, like was also mentioned, like suicide rates in the community,
Yes.
right?
Yes.
That was kind of mumbled, but was that enough, Lois, for like the reason why we'd like them to come for you?
I can request them to come. So to confirm, I have Ryan Marcus from the San Diego High School District, Jewish Family Services, PTA parents, and EUSD and Cardiff School Districts representatives.
We probably don't need the PTA parents. That, I feel like that's a separate conversation.
I'm wondering just agenda lengthwise, is this all going to be for September? Or because I'm thinking that it might make sense to have the Homeless Solutions team and JFS on one day or 1 month, and then do the education specific a different month.
I'm having a feeling that Lois is going to reach out to the availability. They're going to have very tight schedules, and it will probably get an idea of what kind of agenda we'll put. Like, to your point, like, we can't have everybody showing up, right? Maybe we'll probably follow that by email discussion about, like, you know, what makes sense, you know, based on everybody's available schedule. It's kind of a leap of faith there, Lois. Was that a good leap of faith?
I'm sorry, I'm
understanding?
thinking because I think we only have September and December meetings scheduled, correct?
Yeah, so I could see who's available for the September meeting because it's already scheduled. And if they're not able to come to the September meeting, maybe the December meeting, and I can bring it up to you to see which presentations you'd like to come at which meetings.
I have a question, just a point of order. Is it possible for people, guests who come to speak, to do it virtually, or do they have to be here in person? Have to be in person. Okay, thank you.
I think the correct answer is it's possible for them to do it virtually, but there is some very strange rules, as I remember them saying. Yeah.
Just a possibility also, right, December will be the last meeting for wrapping up recommendations. So we might have to entertain at the September meeting another special meeting sometime in October or November.
Love it. Dan, you had talked about people from the homeless ad hoc, like you were thinking about people, third parties, not city staff, right?
Well, there's the homeless response team that touches Encinitas includes street outreach workers. So that's Chad Ryan is the county worker, and PATH is contracted with the County Behavioral Health Services to do street outreach in Encinitas. The woman who does that for Encinitas has been on maternity leave for pretty much the whole year. So her supervisor, Kevin, has been covering that 1 day a week. So that's street outreach. JFS runs the safe parking program. CRC does case management actively in the city. St. Andrews is the other major player.
I'm just bringing up, we're asking Lois to check people's schedules and see if they're interested in coming to speak with us. Are there any people that you'd like to add to the list?
We talked about JFS. I think it would be great if we got some of the BCNC staff, Hannah and Pete or whoever.
Is that enough
If-
information for you, or do you need more information of our request?
No, if people are unable to come for a presentation, I can ask them for resources. So maybe if they want to provide information through a packet of resources, that could help suffice rather than a presentation.
Chair Morton, also to our homeless solutions coordinators do know who all the players are in the organizations because that's who they work with on a daily basis. So it is the BCNC. And of course, it's our county social worker that's part of our HOPE team. So there's a lot of information that when our staff presents that they can present on the different partners that they work with and what they do.
Can I make one recommendation that as, as much as the special meetings seem to be a bit overwhelming right now, I think that it would be beneficial to do a special meeting in October and request the education-specific speakers to come in October. That way, perhaps we can work behind the scenes with the PTAs in the school systems to let families know that they will be here presenting on these specific issues, so that way our community can come and learn more about the mental health resources and issues just in general that are happening within our school, rather than sitting through potentially other speakers.
Just need 4 people to agree that they want to do the meeting, so do we have 4 people?
So
Can we do that on a special meeting, or do we have to do that at a September meeting?
you have to do that at the September meeting to request a special meeting.
Love
Okay,
it.
sounds good.
Can we ask in preparation for the meeting in September that you look into potential dates that work for a special meeting? I think I saw a no from Jennifer. Jennifer, did you say no?
I can't until it's officially motioned.
Yeah, exactly. We can't until a motion has been made and the majority
I
of
got
the,
eagle
of the
eyes,
commission.
Jennifer. I got eagle eyes. It's good to know I still have them. Sorry.
Sorry, Lois,
done.
does that prohibit those of us that have relationships with the people we'd like to come from having a conversation to ask them if there's specific days that work for them?
Yes.
Okay,
As part of the commission, you can't.
sounds good.
Yeah. Okay, so we're tied. It's just a great thing to, I know I was reluctant when we formed the commission at the beginning of the year to having a once-a-month meeting. I've personally have seen it work very well for the Seniors Commission, and many of us have seen the desire to have these special meetings. So I just bring that up when we are doing next year's planning, then perhaps we, consider meeting regularly more frequently and avoid having, because we're all, once we get in it, we're obviously very passionate about it. So Vice Chair Dominguez.
And I'm just going to throw this out there. There is another ad hoc committee. You do know that?
Yep.
Right.
Yeah, I think this
It's called
agenda was,
Resource readiness. And so if we're looking to making recommendations at the end of the year, we should have an opportunity for the Resource Readiness Ad Hoc Committee to at least present what they see as recommendations. They may not be as complicated as what we're doing here, but nonetheless, I think they should go into the report for the end of the year.
I think
I'll
November is
just
wide open.
highlight for you that it's great. That's part of our action item in September to review every ad hoc committee. So that's happening. It's already on the agenda. We're ready and prepared for that.
It's going to be a long meeting.
Wonderful. It's good. I'm not seeing any other speakers. I don't think I need a motion to close. I can just end this, I think is what I learned. So thank you all for your time today. Have a wonderful evening. We're closed.